Come in.
Hi, my name's Kristen. I'm going to be your nurse today taking your health history. Basically what we're going to do today is we're going to take a little baseline about your past and current health conditions, just so we can kind of figure out what's going on and kind of help you out a little bit. So I'm going to start off with just a basic question. What is your full name?
E.G.
E.G. And then what is your date of birth?
January 4th, 1976.
1976, okay. And then why are you here today?
I have this rash on my right arm,
Okay.
and it's also on my neck, and I'm feeling a lot of stress.
Okay. I'm gonna ask you a couple of questions, just again, so we can get a baseline of what's going on and all of your history of medical issues. Do you have any allergies or allergies to like drugs or animals or pets or anything like that?
Animals.
Animals, so no drug or food allergies?
No.
Okay. And then do you have a religion or spirituality that you practice?
I'm Catholic.
And then are you on any current medications? No? And then do you have any history of medical or psychiatric problems?
No.
Okay. And then are there any surgeries, fractures, or injuries that we should know of?
I had an abdominal surgery 2 years ago.
2 years ago? And then are you up to date on all your immunizations?
Yes.
And then what year was the last time that you got updated?
It was this year.
This year? Okay, perfect.
16.
Okay, and then do you have any significant family history that we should be aware of?
My mom has hypertension, and my brother has asthma.
Okay, perfect. Do you, and then when it comes to alcohol intake, on a average, a weekly average, how many glasses would you say that you have?
Maybe like 10.
10, so 10 drinks per week?
Yeah.
And then, do you smoke?
No.
And then, do you use any recreational drugs?
No.
Okay, and then I have a couple more questions. Do you conduct a regular monthly breast self-exam?
No.
And then have you ever had a mammogram?
No.
Have you ever had pap smear?
Yes.
When was your last pap smear?
6 months ago.
6 months ago. And then just to let you know too, for the breast self-exam, we do have information regarding it, just to kind of keep you healthy, because it's just a nice way to make sure that nothing's going on and prevent anything before it happens. So at the end, I can go ahead and give you information if you'd like that. For safety, when you're riding in a car, do you use seatbelts?
Yes.
And then would you say that you use them always, sometimes, or in between?
Always.
Always, perfect. And then if you ride a bicycle or a motorcycle, do you wear a helmet?
No, I don't ride a bike.
Okay. So let's keep moving on to your nutrition and health history. Do you have any dietary restrictions that we should be aware of?
No.
So no dietary restrictions. Do you have any problems related to eating, like physically?
No.
And then can you describe any changes in your appetite if you have any?
I've had a really big decrease in feeling hungry. I just feel like I can't eat all the time because I feel so much stress.
Okay, so you're just kind of overwhelmed, so you aren't feeling like you're eating anymore?
Right.
Now with your appetite change, have you noticed any difference in your weight at all?
I lost 10 pounds.
You lost 10 pounds, and then how long within that 10 pounds did you lose? Like, was it a week, 2 weeks, a month?
Probably within a month.
Within a month, so you lost 10 pounds in a month? Okay. And then, do you have any problems with your oral cavity, like your mouth? Do you have any pain or oral lesions or anything like that?
No, I just have this dry mouth.
A dry mouth?
Yeah.
Okay. And then, when it comes to swallowing and chewing while you're eating, do you have any difficulties doing that?
Sometimes I have difficulty swallowing just because my mouth is so dry.
Okay. And then have you noticed any nausea or vomiting lately?
I have been feeling nauseous.
Nauseous. Does anything bring that nausea on?
When I'm in a stressful situation, or even if I'm just thinking about the stressful situation.
Okay, so you feel a little bit nauseous when you're thinking of something stressful. Okay. Do you have any histories of liver or intestinal problems or anything like that?
No.
Okay, perfect. When was your last bowel movement?
4 days ago.
4 days ago, and then could you describe what it was like?
It was really, really hard.
Or the color, or was it solid or formed or anything like that?
It was definitely a solid.
Solid.
And then it was dark brown.
A dark brown. Okay. And then have you noticed any patterns of like within the past month, like a diarrhea or constipation or anything like that?
Definitely been feeling
Constipated. And then do you have any problems urinating?
Problems? No.
No problems. Do you notice any pain in your urine or anything like that?
No, there's no pain.
No pain?
Just a feeling of, I just feel like I have to go a lot more than I used to.
Okay, so you have a little bit more of an urgency.
Mm-hmm.
Do you notice yourself getting up at all in the middle of the night to go to the bathroom?
Yeah.
And then when you get up in the middle of the night, is that feeling like urgent, or is it just kind of like you have to go?
Yeah, it's pretty urgent.
So it's an urgency when you're getting up in the middle of the night?
Yeah.
And then how many times do you feel like you're gonna get up in the middle of the night?
Probably like twice.
Twice? And then when it comes to sleeping, what time do you normally go to bed at?
There's no specific time.
No specific time. Do you have any issues falling asleep?
Yes.
And then how many hours a night do you normally get asleep?
Maybe like 2, 3.
2-3 hours? And you don't recall when you go to sleep either?
No.
Okay, so you have issues falling asleep, and then when you do fall asleep, it's only like 2 or 3 hours?
Yeah, it's really all over the place. I just can never like rest.
Do you notice any problems like before you fall asleep, or are you like restless, or are you normally tired before you go to bed?
I feel restless. I do feel tired, but it's just thinking about all these stressful things laid on top of me that's making me preoccupied, and I just can't fall asleep.
Okay, so you can't really get comfortable basically. Do you use any sleeping aids like pillows, medications, or alcohol consumption or anything like that to help you fall asleep?
Well, I have been drinking a lot of alcohol, a lot more than I used to, just because it makes me feel a little bit better, and it does make me feel more tired.
Mm-hmm.
So I guess that kind of helps me fall asleep sometimes.
Would you say that it aids you in falling asleep then?
A little bit.
Okay. And then do you exercise or have any recreational activities that you participate in?
No.
No? Okay. And then when it comes to activities of daily living, are you independent in like the areas of like bathing, feeding yourself, taking care of the bills, going to the bathroom, dressing yourself?
Yeah.
So you're pretty independent on all that? You don't need any assistance doing anything?
No.
Do you need any assistance walking or anything like that?
No.
Okay, so when it comes to walking, do you use an assistive device? I'm sorry.
No, I don't use.
And then have you noticed any muscular weakness or fatigue in your body at all?
Yeah, I have been feeling a lot of fatigue.
Fatigue, probably because you aren't sleeping.
Yeah.
And then is the fatigue like constant, or is it just kind of like when you're feeling tired, or is it after doing something like running errands or like anything like that?
It's constant.
Is it constant throughout the day? And then do you have any swelling, redness, or warmth over your joints or anything like that?
No.
And then do you feel any sensations of numbness at any parts of your body?
No.
Okay. And then do you have any cardiovascular problems that we should be aware of?
I do have high blood pressure.
High blood pressure?
Mm-hmm.
And then do you check that on a normal basis or anything like that?
Yeah.
So you check it daily. And then is there any histories of hypertension or a heart attack or blood clots or anything like that?
I
know you-
guess I have hypertension.
Hypertension, yeah, I know you mentioned that before, and I remember that you said that your mom had hypertension too.
Yeah.
So we'll definitely make sure that the doctor looks at that, so we can go ahead and make sure that we're getting a regular reading on that, so we can keep it at a normal rate. And then do you know what your cholesterol level is?
No.
No, okay. And then do you have any problems related to breathing or anything?
Sometimes I'll feel a shortness of breath.
Does that shortness of breath relate to any situations going on, or is it just kind of like an all of a sudden thing?
It happens when I'm in a stressful
Situation. And then do you have any difficulty breathing when you're at rest or with activity?
No, just the stressfulness.
So your shortness of breath is kind of brought over by like thinking of the stressful situations or just being in a stressful situation.
Yeah.
And then have you had a history of pneumonia?
No.
Do you have any vision problems?
No.
Any hearing problems? And then when it comes to memory, are you feeling like you have any problems remembering things?
Yes, I do feel like I'm forgetting simple things like that I have an appointment to go to,
Okay.
or I leave something at home that was really important.
Do you feel like these problems in your memory are more short-term or long-term?
Short term.
Short-term problems? And then with what's going on with your condition, do you feel like it's affecting your self-concept at all?
Yeah, I just feel like I don't have the ability to accomplish all these things that I need to do.
Okay, and then have there been any recent stressful situations in your life?
Yeah, I just recently got divorced, so I am now a single parent of my 10-year-old son, and he has autism, so he has special needs.
Okay. And then with your world relationships, I know that you said that you were just divorced, but do you have any sort of a partner, like a boyfriend or anybody in your life? So you don't have a partner. And then do you have a support system or anybody that you can lean on to kind of talk with you about your problems?
No.
Okay. We do have information about support groups going on too that we can give you again at the end of our session, just so you can kind of have a support system to lean on and maybe make things a little bit more easy in your life. When it comes to your sexuality, are you sexually active?
No.
And then do you have any history of STDs, sexually transmitted diseases? No? Okay, perfect. And then I know again you talked about your divorce and your son and being a single mom and all that. How would you feel if you're coping with these situations? Are you feeling like anxiety, fear, being overwhelmed, or any sense of loss or anything like that?
All of those. I feel anxiety all the time. Okay. And of course I lost my husband, so he's not gonna be around, so I feel like I'm stressed out because I have all these new responsibilities and I'm just not handling this situation very well at all.
Okay, so you're kind of having like a hard time adjusting to your new life, basically.
Yeah.
Okay. Well, that will be it for our health history. I'll let the doctor know about your concerns and I'll let him know about your condition and all that, and then he'll be in shortly. And again, I'll give you all that information too before you leave, just so you can kind of have an idea of like support systems that we have. Do you have any other questions for me?
No.
All right, thank you. The doctor will be in shortly. How long was that? I feel like it was like not that long. 13 and a half. That's not bad.